A lot of people in Singapore, when they work there, are offered health insurance through their company. Unfortunately, these plans are typically of a fairly basic level of cover. Very often they're inpatient only without even an outpatient component. As such, we're often contacted in our Singapore office to provide top-up cover or cover for pre-existing or cover for maternity or perhaps geographical cover that will cover you outside of Singapore. Singapore has a good quality healthcare system, and it's fairly typical to be given an employee benefit to access the inpatient component. But if you're looking for more comprehensive cover or cover to extend beyond your employer's benefit, then talk to us. We have a lot of experience covering these types of issues.
Welcome. My name is Angie Buckner. I'm a faculty member in the Health Science Department at San Jose State University and working with the CSU Health Insurance Education Project, which is a statewide effort to coordinate education and outreach on CSU campuses. The goal of this program is to ensure that members of the CSU community understand their new rights, responsibilities, and opportunities under the Affordable Care Act, known as the ACA. It is estimated that at least 25% of the students in the Cal State system have no health insurance, which is much higher than the UC system or the nation. And we want students to know that health insurance may be more affordable and accessible than ever before. This presentation is designed to help you understand the ACA and learn about Covered California, the new California health insurance marketplace. Like others in the state and the nation, CSU students and their families are uninsured for many reasons. For example, they are denied coverage due to having a pre-existing condition, or they are not offered insurance by an employer, or insurance is unaffordable, which is, by far, the most common reason that people do not have health insurance. So, the Affordable Care Act, which was signed into law in 2010, is designed to help connect the millions of uninsured Americans to quality, affordable health insurance. Some of the key features of this federal law include new insurance options available for all eligible Americans, financial assistance, which may be available to those for whom insurance may be unaffordable, non-discrimination clauses that protect consumers with pre-existing conditions, and essential health benefits in all health plans. So how does this new law affect you? Well, starting January 1st of this year, the ACA will require that all Americans, with some exceptions, have health insurance. Now, it is important to note that if you already have health insurance through an employer or you purchase adequate health insurance privately, you do not need to do anything. But many CSU students and their family members will be eligible for federal support to help cover the costs of health insurance. So why do you need health insurance? You're young and healthy. You need health insurance because things happen. Active lives include the risk of injury. You could get hurt, or you might get sick, and you will want to access preventive care to help keep you healthy. And medical care, especially emergency services, can be very expensive. Treatment for a broken leg can cost upwards of $14,000 when including x-rays, physician services, and hospital stay, and a visit to the emergency room can cost $3,000 per day or more. So the benefit of having health insurance is peace of mind. It can offer protection from high costs of medical care and medical debt. So now that you know why insurance is important, how do you get health insurance? Under the new law, Californians who are eligible for financial assistance in accessing insurance have two means of obtaining that assistance. One way is through the expanded Medi-Cal program. The second is through the new health insurance marketplace, Covered California. Let's first look at the expanded Medi-Cal program. Medi-Cal is a government program that provides free health coverage to qualifying Americans. Eligibility depends on income, and in this expanded program, both individuals, including adults without children, and families will be eligible. Expanded Medi-Cal will be available to individuals and families earning up to 138% of the federal poverty level, which is about $15,000 for individuals and about $31,000 for a family of four. Now, for Californians who don't qualify for Medi-Cal, the second option is to shop for private health insurance through the State Health Exchange, Covered California. At Covered California, consumers can view and compare all eligible health plans for a specific geographic area and determine eligibility for financial assistance, which is available to individuals and family who earn between 138% and 400% of the federal poverty level. That means for individuals who are making between $15,000 and $45,000 each year, and for a family of four with an annual income between $31,000 and $92,000 a year, there is financial assistance to help purchase health insurance. Essentially, the lower the income, the greater the financial assistance. And it is important to note that this financial assistance in purchasing health insurance is only available if the insurance is purchased through Covered California. To meet the goals of the Affordable Care Act, which include improved affordability, quality, and choice, Covered California can offer consumers premiums based on income, financial support to cover costs, preventive care at no additional costs, limits on out-of-pocket payments, comprehensive medical benefits, and a choice of health insurance companies that are available in your area. So if you're not eligible for the expanded Medi-Cal program and you shop at Covered California, you will have two important decisions to make. First, who do you want to be covered by? Covered California offers consumers a clear and simple choice of health plans. It is like going to a shopping mall where you can review all your choices in one place. Deciding on your health plan will depend on the monthly premium, the choices available in your area, and your personal preference. The second decision you will need to make is to choose what metal tier is right for you: bronze, silver, gold, or platinum. And choosing your metal tier is really about how you want to pay for your new health insurance benefits. You can choose to pay a higher monthly premium, which is your monthly bill, and pay less when you need medical care, or you can choose to pay a lower monthly premium but pay more when you need care. The four metal tiers, illustrated by this example, explain the way you will pay for your benefits. The lowest cost premium option is the bronze tier. This tier offers consumers a low monthly bill but higher out-of-pocket costs, which is called cost sharing, and includes fees like deductibles and co-payments. The platinum tier is the most costly in monthly premium, but offers consumers the lowest out-of-pocket responsibility for actual services. This chart breaks down the different tiered options and shows the percent that is paid by the plan and the percent that is paid by the consumer when medical services are used. With the bronze plan, the health insurance company will pay 60% of medical expenditures, and the consumer will be expected to pay the remaining 40%. With the silver tier, the health plan will pay up to 70%, and the consumer will pay the remaining 30%. With gold, the plan pays 80%, and the consumer 20%. And with the platinum, the plan pays 90%, and the consumer pays 10%. To reiterate, these metal tiers differ in the amount you pay monthly versus the amount of cost sharing. The bronze plan has the lowest monthly premium but the highest amount of cost sharing. In contrast, the platinum plan has the highest monthly premium but the lowest cost sharing. Deciding what tier is right for you will depend on many factors, including how you use healthcare services, what your needs are, and what you can afford to pay. Let's look at a couple of examples. First, a young adult in the Los Angeles area who is 21 years old, earns $20,000 a year, and whose tax status is independent. This person could shop at Covered California and find a silver plan that has a $191 monthly premium. Sounds like a lot, but they would be eligible for $120 in premium assistance, essentially dropping the monthly premium to $71. This same individual could choose a bronze plan at $154 a month, and with the same premium assistance of $120, the monthly payment drops to just $34 for health insurance. Let's do the same thing with a family of four. Parents, ages 43 and 45, and two children, ages 19 and 21, with a household income of $48,000 a year. This family can find a silver plan that has an $847 monthly premium. The family is eligible for $651 in premium assistance, bringing the bill to only $196 a month. This same family could shop for a bronze plan and find one for $682 a month. After considering the premium assistance of $651, the family is left with a $31 monthly health insurance premium. The clear advantage to the bronze plan is the low monthly premium. For students, this might be a particularly good choice. While it comes with a high out-of-pocket cost, students are likely to have access to many health services available on campus through a student health center. The disadvantage of bronze tier plans is clearly the high cost sharing that will be incurred through deductibles and copays when medical services cannot be provided by the student health center. In comparison, the silver tier may cost more in monthly premiums, but the amount paid for actual services is lower than the bronze plans. So, if you know that you need to see a medical provider regularly, a silver plan may be of greater value. So which choice is best for you? Well, this is not a simple decision and one that will require thought. You may consider a plan with a low monthly premium if you do not use health services often, but you may want to consider a higher premium if you do use regular health services. So how much is this going to actually cost? Let's bring this back to college students again and look at a few examples. First, we have a 23-year-old student making $15,000 a year, or less. This student will be eligible for Medi-Cal, so the government will pay all costs and the student pays nothing to have coverage through Medi-Cal. Let's look at another example. Another student, age 21, making $18,000 a year. This student could find a bronze plan for $154 a month. The student would be eligible for $140 in financial assistance and would have a monthly premium of just $14 for bronze level coverage. Keep in mind, rates may be slightly different depending on where you live, the insurance company you select, and the metal tier that you choose. Now let's look at a family example. First, a family of 3, 2 adults, both aged 43, and a 21-year-old child. Their household income is $40,000 a year. Through Covered California, the family can find a bronze level health plan with a monthly premium of $571. However, the family would be eligible for a $545 premium assistance. After that assistance is factored in, the family would be responsible for $26 a month for health insurance to cover the entire family. Lastly, another family example. Similar to the first, but let's add another adult child and increase the household income to $50,000 a year. So this family of 4 could find a bronze level plan for $682 a month. They're eligible for $628 in financial assistance and will find themselves with a monthly insurance premium of $54. Again, this covers the entire family. So we think you should get health insurance because it is a good idea. But if you don't, there will be a penalty. Beginning the first of the year, most Americans will be required to have health insurance or pay a fine. In the first year, this fine will be $95 or 1% of the household income, whichever is higher. For many students, it will cost less to buy health insurance than to pay the fine. And you'll be getting something valuable for your money. So check things out. Health insurance might be cheaper and easier to get than you think. You already have some important experience with paperwork, including the annual FAFSA and your taxes. If you've done these, you'll find that enrolling for health insurance through Covered California is just as easy. And when you're ready to enroll, you'll need to know a few things. Your tax status, dependent or independent, your wages earned. If you are applying as a family, the total household income. You will also need to know the birth dates for all individuals in the household. One benefit of shopping online through coveredca.com is the Shop and Compare tool, which offers side-by-side comparisons of available insurance options. For this first year, you can sign up during the extended enrollment period through March 2014. But if you enroll by January 15th, your coverage will begin on February 1st. When you're ready, you can enroll online at www.coveredca.com, in person with an enrollment counselor in your community, or on the phone with a Covered California representative. There are lots of options and several ways to get help. Before we conclude this presentation, we would like to share some common myths and frequently answered questions on our campuses around the state. Myth number 1. I pay a student health center fee, so I am covered. The reality is that campus health centers are valuable resources, but not health insurance. Your student health center fee is for the student health services, and these are really important. However, having access to the student health center is not the same as having health insurance. The health center may provide primary care and preventive services, but the health center does not cover most specialty care, nor does it cover hospital care, off-hours care, or many tests and procedures. Myth number 2. I can just go to the emergency room if anything happens. The reality is that yes, you will receive care if you are uninsured, but being uninsured does not mean your care will be free. Emergency rooms will still bill you, and emergency room care can be very expensive. And now for some of our most frequently answered questions. First, is everyone eligible to get health insurance through Covered California? No. To be eligible, you must be lawfully present here and be able to provide proof of this. What if I don't currently live in the same zip code as my permanent address? This is fine. Health insurance costs and the financial assistance for which you may be eligible will be determined based on the zip code where you will actually be receiving care. What if I'm from out of the state? In California, legal U.S. residents may be eligible for health insurance through Covered California if they are able to demonstrate proof of residency. Establishing residency in this state requires proving intent to reside in California, but does not necessarily require a minimum time of having lived here. How does student financial aid affect my eligibility? Student financial aid can be in the form of federal or state grants, student loans, or work study. Non-taxable income does not affect eligibility for financial assistance, so grant money that is used for tuition, fees, books, or supplies is not taxable and thus will not influence your eligibility for financial assistance. Grant money that is not used for those educational expenses is taxable and may affect your eligibility for financial support. Student loans are considered borrowed money and are not taxable. What happens if my income changes? It either goes up or down. It is your responsibility to report any changes in your income. Increases in income may reduce the amount of financial assistance you receive, and decreases in income may increase the amount of financial assistance you receive. Tax payments or credits will be adjusted to reflect the correct change in premium assistance. These are some of the questions that we hear most frequently on our campuses, but we know that you are likely to have more questions. To get your specific or personal questions answered, we encourage you to contact a Covered California representative or sign up with us and learn about events that may be happening on your campus. So to summarize this presentation, the key messages are that having health insurance is important and that access to affordable health insurance in the U.S. is now within reach for millions more Americans. And our CSU students are no exception. Many students are surprised by how low the premiums can be. So we encourage you to talk with your family about health insurance and shop around, see what's available in your area. If you're ready to enroll, you can shop right now at coveredca.com. You can also sign up to receive updates and connect with our CSU project. Thank you for listening, and we look forward to continuing to provide our CSU campus communities with information on affordable health insurance.